What if some of the medical tests you trust the most aren't always necessary after 65? Not dangerous, not wrong, but in some cases, not as helpful as you think. For many people, regular testing feels like the safest choice. More exams, more information, more control, and that makes sense because you want to stay ahead of problems, catch things early, and take care of your health. But here's what most people are never told. More testing doesn't always mean better outcomes. In some situations, it can lead to unnecessary stress, additional procedures, and even treatments that may not have been needed. I've had patients come into my office more worried after a routine test than before they took it, not because something serious was found, but because something unclear was. My name is Dr. Adrian Keller, and today I'm going to walk you through 6 medical exams that doctors often rethink after 65 and explain when they may not be necessary and why that matters. Because when it comes to your health, more is not always better. Let's take a closer look. Let's be honest for a moment. Most people over 65 are trying to do the right thing. You go to your appointments, you follow recommendations, you agree to tests because you trust the process. And in many cases, that's exactly what you should do, because preventive care matters. But here's what I've seen over and over again. People start to believe that the more tests they take, the safer they are. So they say yes to everything. Blood work, scans, screenings, sometimes even repeating tests more often than necessary. And it feels responsible, proactive, like you're staying ahead. But sometimes that approach can lead somewhere unexpected, because not every test adds clarity. Some tests add uncertainty, and that uncertainty can lead to more testing, more follow-ups, and more concern, even when nothing serious is actually happening. That's where things begin to shift, because at a certain point, it's not just about doing more, it's about doing what actually helps. Now let's look at one of the biggest misconceptions that leads people in this direction. One of the most common beliefs I hear is this: the more tests I do, the safer I am. And I understand why people think that. It feels logical. More information means more control. But in medicine, it's not always that simple, because not every test leads to a clear answer. Some tests find things that were never going to cause a problem. Small changes, minor irregularities, things that would have stayed unnoticed for years without impact, but once they're found, they can't be ignored. And that's where a new cycle begins. More testing, more monitoring, sometimes even unnecessary treatment. I often explain it like this: just because you can measure something doesn't always mean you should, especially if that measurement doesn't change what you do next. And this becomes more important after 65, because at this stage, the goal is not just finding everything, it's focusing on what truly affects your health and quality of life. Now, before we go into specific exams, there's something important we need to clarify, because this is where people often misunderstand the message. Before we go any further, I want to make something very clear. This is not about avoiding medical care, and it's definitely not about ignoring your doctor's advice. Every test, every recommendation should be considered in the context of your personal health, because medicine is not one size fits all. What may not be necessary for one person may be essential for another. I tell my patients this all the time. There's a difference between routine and relevance. A test might be routine, but that doesn't always mean it's still relevant for you, especially as your health changes over time. Age, medical history, current conditions, all of these factors matter. So the goal here is not to say, never do this test. It's to understand when a test may no longer provide meaningful benefit and when it's worth having a conversation about it, because informed decisions are always better than automatic ones. Now, with that in mind, let's look at the first exam, because this is one I see discussed very often. The first exam is the PSA test, a blood test commonly used to screen for prostate cancer. Now, this is an important test in many cases, but after 65, the conversation around it can become more nuanced, because the PSA test doesn't just detect serious problems. It can also pick up very slow-growing changes that may never actually cause harm. And that's where the concept of overdiagnosis comes in. I've seen patients go through this situation. A slightly elevated PSA result leads to more testing, biopsies, and a lot of anxiety, only to find that what was detected was unlikely to affect their health in a meaningful way. But once it's found, it's very difficult to ignore, and that can lead to decisions that may not always improve outcomes. Now, to be clear, this doesn't mean the PSA test is unnecessary. For some individuals, it can be very important, but after a certain age, and depending on overall health and life expectancy, the benefit of routine screening may need to be reevaluated. This is why many medical guidelines suggest a more individualized approach, not automatic testing, but a conversation. Because the goal is not just to detect something, it's to detect something that actually needs to be treated. Now, let's move on to the next exam, because this one is also very common and often repeated more than necessary. The next exam is colonoscopy. Now, this is one of the most important screening tools for detecting colon cancer, and in many cases, it can be life-saving. But the key word here is frequency, because colonoscopies are not meant to be done every year or too often without a clear reason. In many situations, if a previous exam was normal, the recommended interval can be several years, and after 65, especially depending on your overall health, that interval may become even longer. I've seen patients who undergo repeated colonoscopies simply out of habit or because they assume more frequent testing is safer, but every procedure, even routine ones, comes with some level of risk. Preparation, sedation, the procedure itself. So the goal is not to avoid it, it's to use it appropriately. When it's needed, it's extremely valuable. But when it's repeated without clear indication, it may not add meaningful benefit. And this is where understanding guidelines and discussing your individual situation with your doctor becomes essential, because the best care is not always more care. It's the right care at the right time. Now, let's move on to the next category. This one often feels routine, but can sometimes lead to unnecessary follow-ups. The next category is imaging tests, things like CT scans, MRIs, and other detailed imaging exams. Now, these are powerful tools. In the right situation, they can provide critical information, but when they're done without a clear reason, they can sometimes create more questions than answers. I've seen patients go in for a scan just to check everything. No specific symptom, no clear concern, just the idea that more information is better. And sometimes, the scan finds something, a small spot, a minor irregularity, something completely unrelated to how the person feels. And in many cases, that finding turns out to be harmless. But once it's discovered, it can't be ignored, which leads to more scans, more follow-ups, and often, more anxiety. We call these incidental findings, things that were never going to cause a problem, but now require attention. And after 65, these findings become more common because the body naturally changes over time. I often explain it like this. If you look closely enough, you will almost always find something, but not everything you find needs to be treated. That's why imaging tests should be guided by symptoms and clinical need, not just curiosity, because while these tools are incredibly useful, they're most valuable when used with purpose. Now, let's move to the next exam. This one is very common in routine checkups, but often repeated without a clear benefit. The next category is what many people call a full checkup, a broad set of tests done all at once, often without a specific reason. Blood panels, heart tests, scans, everything at once. And again, this feels like the safest approach. The idea is, if I check everything, I won't miss anything. But in practice, this approach doesn't always lead to better outcomes, because when you test many things at once, you increase the chance of finding small variations, values slightly above normal, slightly below, things that may not actually indicate a problem. But once they appear on a report, they often lead to further testing, follow-ups, more analysis, sometimes unnecessary concern. I've seen patients go through multiple rounds of testing, not because something serious was found, but because something unclear was, and that uncertainty can drive more and more intervention. I often tell my patients, testing should be guided, not just performed, because the goal is not to collect data. It's to gather useful information that actually helps guide decisions. After 65, this becomes even more important, because your care should be focused on what matters most: your current health, your symptoms, and your quality of life, not just numbers on a page. Now let's move on to another pattern I see often, and this one happens quietly over time. The next pattern I see often is the repeated use of the same tests without a clear change in condition. For example, blood work done again and again at short intervals, even when previous results were stable. Now, in some situations, regular monitoring is important, but when tests are repeated without a specific reason, they may not provide new or useful information. I've had patients bring me results from multiple tests over time, and when we compare them, there's little to no change. But each test still creates a moment of concern, waiting for results, reviewing numbers, wondering if something has shifted, and when this cycle repeats frequently, it can become more about reassurance than actual medical need. I often explain it like this. A test should answer a question. If the question hasn't changed, the answer likely won't either. And after 65, this becomes even more relevant, because your care should be focused on meaningful changes, not constant checking. When something is stable, it's often better to respect that stability than to challenge it repeatedly. Now let's move on to the final exam. And this one is not defined by the test itself, but by the reason behind it. The final category is not about a specific test. It's about the reason behind it. Tests done primarily out of fear. I've seen this many times. A headline, a story from a friend, something seen online, and suddenly there's a concern. What if I have that too? So the response is to request a test. Not because of symptoms, not because of medical history, but because of uncertainty. And that's completely understandable. Wanting reassurance, wanting clarity, wanting to feel safe. But when testing is driven mainly by fear, it can lead to a cycle that doesn't always help. Because as we've discussed, more testing can sometimes uncover things that were never going to be a problem, and that can create more questions, more follow-ups, and more worry. I often tell my patients, it's okay to be cautious, but caution should be guided, not reactive. Because good medical care is not just about finding things, it's about finding what actually matters, and that requires context. Understanding your history, your current health, and what truly needs attention. Now here's something that ties all of this together, and it may change the way you think about testing entirely. Here's something that often surprises people. In some cases, doing more tests can actually lead to more problems. Not because the tests themselves are harmful, but because of what happens after. A result that's unclear leads to another test. That test leads to another finding, which leads to another procedure. And before you realize it, you're in a chain of follow-ups that started from something very small. We call this a cascade effect, and it's more common than most people think. I've seen patients go through multiple procedures, not because they were sick, but because something minor was discovered and investigated further. And sometimes, those procedures carry their own risks, discomfort, side effects, complications that could have been avoided. I often explain it like this. Not every finding needs to become a journey, because the goal of medicine is not just to find everything, it's to improve outcomes, and sometimes doing less actually protects more. Now let's talk about what you should do instead, because this is where everything becomes practical. So what should you do instead? The goal is not to avoid testing, it's to make better decisions about it. The first step is to ask the right question. What will this test change? Because a good test should lead to a clear next step. If the result won't change your treatment or your approach, it may be worth discussing whether it's necessary. The second is to have an open conversation with your doctor, not just accepting every test automatically, but understanding why it's being recommended, what the possible outcomes are, and how it fits into your overall care. The third is to focus on what actually impacts your health, symptoms, function, quality of life, because after 65, the goal is not just to detect everything, it's to maintain well-being. I often tell my patients, good care is not about doing more. It's about doing what matters. And finally, be comfortable with the idea that not every situation requires immediate action. Sometimes monitoring, waiting, and observing is the better path. Now let's bring everything together, because this final perspective is what truly makes the difference. So let's bring this together. The idea that more testing always leads to better health is not always true. After 65, the conversation begins to shift. It's no longer just about finding everything. It's about focusing on what truly matters. We talked about the PSA test and how results can lead to overdiagnosis, colonoscopy, and why frequency matters. Imaging tests and the risk of incidental findings, full checkups, that may create more questions than answers. Repeated tests without meaningful change, and tests driven by fear rather than clear need. None of these are bad tests, but each one needs context. Because the right test, at the right time, for the right reason, is what actually improves outcomes, not just more testing, better testing, more informed decisions, and a focus on your overall well-being. Because at this stage, your health is not just about numbers, it's about how you feel, how you function, and how you live your life. If this video helped you, share it with someone who might benefit from it. And if you want more clear, practical insights like this, focused on helping you make informed decisions about your health, make sure to subscribe. I'm Dr. Adrian Keller. Stay informed, stay thoughtful, and take care of your health. I'll see you in the next video.